MidPoint continues as we welcome back the former governor of Utah, former secretary of the U.S. Department of Health and Human Services, Michael Leavitt. Mr. Leavitt, let's get back to the question then that we had posed just before the break here. If we have to find that person or that group on the ground level who truly failed the American people to get us ready for this, where do we start?
Well, I think it would be an unproductive search to find the one person or one group, because it's bigger than that. You have to think of this in steps. The first step is the first strategy is to try to snuff it out. Think of it as a forest fire. In forests, they'll put stations where you can watch for smoke. And when you see smoke, they'll deploy a team as rapidly as they can to that site and stamp out that fire. Because if they don't, it will quickly spread. Sometimes it has already spread a bit. And then the goal is the second phase, which is to contain. And that's when they know they have victims, and they'll isolate them and find ways to try and figure out who they've had contact with. That's exactly what's happening in Dallas today. We're working to contain it. Then the third step is to go to a vaccine, and that's to produce a vaccine that's effective against the virus, and then distribute it as widely as necessary to try to contain it. And then the last step, if all of that fails, is to simply get out of its way in the same way you would a forest fire, and ultimately it begins to burn itself out. Now, that's a horrific scenario, but it's happened over the course of time, and we now have tools that we didn't have in the past. We now do have vaccines, we have communication, but these are global. This is international. We don't have the ability to snuff it out on our own in Liberia. We don't have the ability to contain it if it's going across Africa. And ultimately, somebody is going to spread that. So I think that trying to assign blame here is probably not the most productive thing. The most important thing we can do is figure out how we can prepare and contain it and stop it.
Then let's look at right now then. Senator John McCain has called for an Ebola Czar. Do you think that's a good idea?
I'm not certain that the idea of having a czar makes a lot of sense. There is a well-defined federal disaster response plan that has essentially the requirement of appointing what they call him a federal coordination officer. Because in the final analysis, this is not going to be the federal government. It's going to be state and local governments who have to deal with this. Having a coordinating point is right. Whether you call them a czar or whatever you want to call them, there will be a coordinating point if this becomes a disaster that's national in scope.
Did we fail perhaps by not having a Surgeon General in place?
The Surgeon General has a big brand. The big brand says that we all know who the Surgeon General is, but the reality is the Surgeon General is at the third level at HHS, has no staff, is not necessarily trained to lead in emergencies. That capacity is elsewhere. For example, at the Centers for Disease Control. And they have the skills, they have the experience, they have the know-how, and they're doctors just like the Surgeon General. So I think the Surgeon General has a role, but it's mostly to be able to help communicate the message, but not to be in charge.
Do you fear that this disease could go airborne and perhaps can mutate to something more contagious?
There's always the possibility that a virus can mutate. And I still don't believe we know that we're 100% sure how this is transmitted. And I think the nurse in Dallas is one of the reasons that we have that concern. If you go back to history and say the pandemic of 1918, most shaping and the most difficult pandemic we've ever faced in this country, you can actually trace that back to an incident where one or two people got it and then it was failed to be contained. So what's happening in Dallas and other places is very important, and it's critical to have the kind of professionals that are available at CDC and at local and state health departments around the country managing that.
Michael Leavitt, I want to thank you so much for your comments on this. Certainly, you are certainly aware of what it takes at this sort of a level to get involved and take a handle on a case like this. I hope we have a chance to talk again and get your expertise. Thank you very much.
You're welcome.
All right. Now, today, we want to get your opinion on this Internewsmax poll. We have also talked about not only what needs to be done, and you certainly heard the former governor, talk about what needs to be done right now and going forward. But let's talk about where we are at this point. There are those people, and let's not talk about blame here. As he said, we've gone past the point now of worrying about who's to blame, why this started, and of course blaming Republicans for it, but the Democrats is just so silly on its face to begin with. So let's go with this. Is the President of the United States handling the Ebola crisis properly? Because at the end of the day, no matter how you look at it, the buck stops there. There's your question. Vote now. Go to www.newsmax.com/poll. Is the President handling the Ebola crisis properly? We'll get your opinion. We'll talk about it here. And after the break, the call for a better minimum